Hello, my name is Alina Pokhrel and I am a student nurse from Western Sydney University. This is my student ID card. Good morning, my name is Alina Pokhrel and I am a student nurse from Western Sydney University. Please have a seat.
Thank you.
No worries. Are you comfortable in that chair?
Yeah, I'm good.
Okay, so how are you feeling today?
Not too bad. What about you?
I'm good, thank you. I'll be assessing your general health, which will take around 10 to 12 minutes, and I will record some of your information. Is that all right?
That's all good.
So let me have a look through your patient notes for a while. Okay. Let's get started with your full name and your date of birth, please.
My name is George Pan,
Mhm.
and I was born on 17th of January 1946.
So your name is George, George, Pham, Pham. Is that right?
Yeah,
And your date of birth is 17/1/1946?
yeah.
Okay. Where are you living currently, George?
I'm living at 52 Homebush Street, Central.
52 Homebush Street Central.
Yeah,
What's your postcode?
it's 2001.
2001.
Yeah,
Okay. Can you give me your contact details, please?
it's 0414 296 397.
0414 296 397, right?
Yeah,
Okay. Now let's start with a simple question. Do you have any non-allergy?
and no, not that I know of.
No allergy. That's good. Can you provide me some information about your background, like your culture, occupation?
Well, I'm originally from Vietnam and I'm a Buddhist.
Mm-hmm.
I moved to Australia along with my wife and my daughter in 1979.
Yep.
But my wife died of ovarian cancer 5 years after moving to Australia.
Oh, that's sad.
Yeah, and then regarding my occupation, I work as a baker.
Okay, so do you feel lonely?
Well, after my wife passed away, I used to feel lonely,
Mm-hmm.
but now I'm completely filled up with my work and my grandchildren, so I don't feel lonely at all.
Okay. And did you find it difficult to live in a different place, in a different cultural background away from your home country?
Where, well, when you move to different country, obviously you need to face different cultures.
Yeah,
So at the beginning, it was quite difficult for me, but
that's
now
true.
me and my family we have completely blended in this culture.
Well, that's true. It's difficult for international people to live in a different country because I'm also from Nepal and I also felt difficult at the beginning here.
Uh,
But now you are completely blended in, and that's wonderful.
yeah,
So you mentioned that you work as a baker, right?
yeah.
Which shifts do you normally do?
I usually work in the early morning.
Okay, so do you eat your breakfast before going for your job?
I hardly get any time to do any breakfast, so I have to skip the breakfast.
Okay. Then how many meals do you eat normally in a day?
Well, sometimes I do my lunch and my dinner, sometimes only lunch. It depends.
Okay. What do you normally eat in a lunch and dinner?
Well, I usually do takeaways from a local Asian cafe, so and buy some fried noodles or rice. Yep.
So only fried noodles and rice,
Yeah.
no fruits and vegetables at all.
No.
Now I guess since your BP and your heart rate is quite high from your patient notes, I suppose that it's because you eat a lot of carbohydrates only and not enough protein and fruits and vegetables. So George, I would advise you to include fruits and vegetables, plenty of fruits and vegetables in your everyday meal, so that you will be healthy.
I get it about the proteins and the diet,
Mhm.
but how come carbohydrate affect the blood pressure level?
Because when the carbohydrate is very high in our body, then the production of two hormones, insulin and epinephrine, it also becomes high. And those two hormones directly result in high blood pressure and high heart rate. So it is very essential to eat fruits and vegetables every day.
I'll surely follow that.
Okay. Uh, and what about smoking and drinking? Do you drink or smoke?
Well, I used to smoke, but I
Mhm.
recently quit. I used to smoke around 20 cigarettes a day for the past 42 years.
Mm-hmm.
And regarding alcohol, I drink around 3 to 5 standard drinks per day with my meal.
So you quit smoking already, right?
Yeah,
Okay, that's good to hear. But regarding alcohol, you told that you drink 3 to 5 standard drinks per day, right?
yeah.
Uh, the thing is that the recommended alcohol intake is only 2 standard drinks per day,
Mm-hmm.
and since you drink 3 to 5 drinks every day, that's quite high. It the more alcohol intake also results in high blood pressure. Were you aware of that thing?
Well, I've been trying to quit alcohol as well, but it has really been difficult for me because um, I am living a very stressful life. I have my work. I need to look after my grandchildren, so
Yep.
that's the only thing I get by. You know, so it's it's been really difficult.
Okay. So you felt it difficult, but it's not that impossible because lots of our patients they used to drink alcohol, but once they come here, we have different helplines and psychologists that help people to quit smoking to get over their stress. So if you if you are interested, then we can give their contact details to you.
Yeah, that sounds wonderful.
So I'll give you their contact details at the end. All right?
Okay, that's all right.
Okay. Now let's move on to the next part. What is your major health concern that brought you here today?
Actually, I have been having persistent cough,
Mm-hmm.
so I came here to see the doctor.
Persistent cough.
Yeah,
Okay. How long have you been coughing?
I have been coughing for almost 5 weeks.
5 weeks of persistent cough. Well, that's been a long time. Did you see any doctor before?
No, I haven't seen any doctor.
No doctor. So, do you feel any pain around your chest or your throat due to this coughing?
No, there is no any pain around.
No pain. So what I can do for now is that I will ask one of our GP to see you as soon as possible after this assessment maybe because your blood pressure and heart rate is also quite high and you have been coughing persistently from 5 weeks, so it is very essential to see the doctor very soon.
Yeah,
Will you be fine to see the doctor after this assessment?
yeah.
Okay, then I'll book you in to see the GP after this assessment. Okay. Now, can you tell me what do you normally do in your free time? Do you do exercise?
Well, I hardly get any free time, but
Mm-hmm.
whenever I do, like in the summer, I like to go to beach.
Yep.
I like to walk on beach. And regarding the exercise, I don't do any exercise.
Okay. No exercise. Are you aware that doing exercise regularly improves our muscles and body health?
Well, I do realize that, but I hardly get any time, so
Mm-hmm.
I can't get along it. That's why.
Okay. So, whenever you have free time, try to involve in just simple exercise. Not don't spend too much time on like gym or anything. Just do simple exercise like jogging, running, skipping, whatever you can do.
Mhm.
I suppose that will also help you feel better and relaxed
Okay,
and have a healthy life.
I'll surely do that.
Okay. And about going to beaches, do you put your sunscreen before going to beaches?
No. Usually I don't even wear a hat. I think
Mm-hmm.
my body just gets tanned rather than burned.
But that's not true, George, because skin health is really important. And when you go out in the sun without applying sunscreen, then you might get different kinds of rashes or burns that you might not have noticed till now. And also, the harmful radiations from the sun they might cause skin cancer as well. So, applying sunscreen is really a very important thing when you expose yourself in the sun. I hope you will apply sunscreen from now on.
Obviously, I'll do that. Yeah.
Okay. All right, George. This is almost the end of our assessment. So, do you have any further questions?
No. Thank
We-
you for making me clearly understand these things.
Okay, no worries. Uh, do you want to make a follow-up appointment anytime soon?
Yeah.
Okay. When are you free to have a follow-up appointment?
Maybe next week.
Which day and next week?
Anytime on Monday.
Will Monday afternoon work for you?
Yeah.
Okay, then I'll book you in for a follow-up appointment on Monday afternoon.
Okay.
And I hope that this conversation will bring positive changes in your life, and you will remember everything we explained today, like putting on sunscreen for your skin health, doing exercise regularly, and cutting on alcohol as well, including fruits and vegetables in your diet. I hope you remember everything and
Yeah.
try to apply in your daily life.
Yeah.
Okay. Thank you, George, for your time, and the GP will be here soon to see you. Please talk to him clearly about all of your problems, your coughing problems.
Okay.
And as I promised, this is the contact details of the helpline that help patients to recover from drinking habit.
Oh, okay. That's good.
Please try to contact them and talk to them.
I'll call
They
them
might
today.
help you.
Yeah, I'll call them today.
Okay, no worries. Okay, thank you, George. I'll see you soon.
Thank you, Nurse. See ya.
Thank you.